Hey there, and welcome to the clinic. If you're a first-year physiotherapy student, consider this explainer your official Day 1 orientation. Listen, before you start prescribing treatments or laying hands on real patients out there on the floor, we really need to master the fundamental science behind what we're actually doing. Today, we're focusing on therapeutic heat. We use it literally every single day to manage pain, loosen up tissue, and kickstart healing. But here's the thing. Heat isn't just magic, it's physics. And really understanding the physics of heat therapy is exactly what separates a button-pushing technician from a true clinical expert. Okay, let's dive into this. Here is your syllabus for today's clinical walkthrough. First, welcome to the clinic. Second, modes of heat transfer. Third, tissues and temperature. Fourth, real-world application. And finally, patient safety first. All right, Section 1, welcome to the clinic and your quick physics refresher. So, before you place even a single hot pack on a patient's back, we absolutely have to understand how heat energy works at a foundational level. And we really can't talk about thermal modalities without grasping this absolutely crucial concept, latent heat. By definition, latent heat is the heat energy that's absorbed or released during a change of state. So, think about steam condensing into water. The mind-blowing part here is that this massive energy exchange happens absolutely without a change in the actual temperature of the substance. Think of latent heat like a giant hidden energy battery. Take a moist hot pack, for example, something we use all the time here. When the steam from that hot pack condenses directly onto your patient's cooler skin, it's changing state, right? From gas to liquid. And in doing so, it suddenly unleashes a massive hidden payload of energy, the latent heat of condensation, driving it directly into their tissues. It's an incredibly powerful tool when you know how to harness it. Moving on to Section 2. Modes of heat transfer. Let's take a look at the actual tools in our arsenal. Let's step out of the classroom for a second and mentally walk over to the equipment room. Our first mode of heat transfer is conduction. I want you to visualize conduction as a direct, physical handshake between materials. That physical contact is absolutely necessary for the heat to flow. If you grab a hot pack or set up a paraffin wax bath and put it on a patient, the heat transfers from the hot object right into the cooler skin through that physical touch. No handshake, no heat transfer. It's that simple. Now let's contrast that direct physical touch with our second mode, radiation. Unlike the conduction handshake we just talked about, radiation doesn't need to touch you at all. It transfers heat through electromagnetic waves. Imagine an infrared lamp pointing at a patient's shoulder. The lamp never actually touches the skin, but those electromagnetic waves travel right through the air, enter the tissues, and magically convert that radiant energy directly into internal heat. And this brilliantly illustrates our third mode, convection. Let's compare a standard hot pack to a whirlpool bath. A hot pack just sits there, right? It's static, conduction, relying entirely on a set temperature gradient. But a whirlpool bath utilizes convection, which transfers heat through the actual movement of fluids. Those heated water particles are agitated, constantly swirling around, carrying energy, and continuously brushing against the patient's skin. It creates a highly efficient, super uniform heating effect. All right, Section 3, tissues and temperature. Let's see how bodies actually react to all this. Knowing our tools is great, but remember, we're treating actual human bodies. When we look at Lehman's principles of therapeutic heat, we uncover a massive difference in how different tissues conduct that heat. Muscle and blood, they have extremely high thermal conductivity. They essentially welcome the heat in, conducting it rapidly and efficiently. But fat, adipose tissue, has incredibly low thermal conductivity. It literally acts as a stubborn physical insulator, actively fighting against the flow of heat, trying to reach the deeper tissues. And this tissue conductivity thing totally dictates our clinical choices. Because human tissues like muscle are so conductive, moist heat is almost always vastly superior to dry heat. When you combine the naturally high conductivity of a moist environment with that hidden energy battery of latent heat we talked about, a moist hot pack becomes an absolute powerhouse for safely driving therapeutic heat deep into the targeted muscles. On to Section 4, real-world application. Let's run through some modality selection cases. Okay, time to mentally put your scrubs on. We're heading to the clinic floor. Here's your first case. Patient A comes in with a lower back strain, but they have a notably thick layer of adipose tissue right over the targeted muscle area. Knowing what we just learned about tissue conductivity, how do we adjust our heating modality to make sure the underlying muscle actually gets any therapeutic benefit? Spot on. We have to increase the duration of exposure. So the crucial point here is that because fat acts as an insulator with that super low thermal conductivity, it seriously slows down the rate of heat flow. We can't just crank up the temperature, right? That's exactly how you burn somebody's skin. Instead, we alter the physics of our treatment by safely extending the time, letting that temperature gradient slowly but surely penetrate through the barrier of fat. Awesome. Let's check out case 2. Patient B is a runner who comes in with a superficial calf strain. We need highly efficient, rapid beep surface heating to prep that tissue for manual therapy. Given the choice, do we reach for a standard electric dry heating pad or a hydrocolloidator moist hot pack? You guessed it, the moist hot pack. This beautifully ties all our physical principles together. The moist pack uses that latent heat of condensation, releasing a huge burst of hidden energy right onto the skin. The moisture creates an environment with much higher conductivity, which then rapidly and efficiently drives that thermal energy straight through the skin and right into the highly conductive muscle beneath. Honestly, it's textbook physics in action. And finally, Section 5, patient safety first. First, do no harm. All right, I'm putting my mentor hat firmly on for a second because this is serious. Ultimately, the entire reason we study this physics is to keep our patients safe. So here is your essential, non-negotiable safety checklist. First, always physically check the temperature of your packs. Second, use adequate towel layers between the pack and the patient. These act as your artificial insulators to control the conduction rate. Third, take off all metallic objects, especially jewelry, from the treatment area. Metal is highly conductive and will cause severe burns, especially with radiation like an IR lamp. Fourth, listen to your patient. If they feel a burning sensation, you stop immediately. And lastly, for convection modalities like whirlpools, you must maintain absolutely strict infection control protocols. Well, we've officially covered the syllabus. You now understand the physics of therapeutic heat, from the hidden battery of latent heat all the way through conduction, convection, and radiation, down to the clinical reality of highly conductive muscle versus insulating fat. But here's my final challenge to you. When that very first patient walks through our clinic doors looking for relief, how will you actively control these physical forces to heal them before the physics controls you? Keep that in the front of your mind as you step out onto the floor. Good luck today, you're going to do great.